Welcome to Two Feet Told Podcast. My name is Erica and this is Brandy.
Hey, what's going on?
If you guys are joining us for the first time, our podcast is focused on providing underserved and underprivileged communities, particularly communities of color, with the information and tools to help improve their healthcare, dental healthcare experience.
Yeah.
Okay, so this is part two of our Veneers series, the restorative care series. We have been having a restorative care series, and we did an episode last week about veneers, and this is part two of that episode. So let me clarify that.
Yes.
Sorry.
Here we
Okay.
go.
All right. So we're gonna start off with what we left off last week. We said we stopped with talking about what happens before dental veneers placement. So now we're going to talk about what happens during veneer placement. So Brandy, take it away.
Yeah. Okay. All right. So yes, during the procedure last week, I missed a so important thing when I was talking about during the procedure. I did not say, so I said that, your teeth will be examined, your gums, blah, blah, blah. But I did not say that you are going to have your teeth prepared. So that means at that appointment, they're going to remove the enamel surface of your tooth, prep the teeth for the placement. So you're going to have all that done, and then the temporary is placed on top of the prepped area. So there is going to be tooth structure removed. So my bad, I didn't mention that last time. So now that the tooth structure is removed and you have the temps on, you're going to come back, like Erica said, and we're going to talk about what happens during that procedure. So when you come back for the second time, they are going to check the shape and the color and the fit of the veneers before they're actually permanently bonded using a dental cement. So they'll remove those temporaries. They will place the permanents on and just make sure everything looks good. Make sure you like the color, make sure they match everything else. If something's off, they can put the temporaries back on and send whatever needs to be fixed back to the lab until it's perfect, until it's the way you want it to look, until the dentist is happy with it. They'll make any necessary adjustments. And then once everything is all good, it will be cemented. So for some reason, if you didn't like something, or if the shape was completely off, or it was just not at all what you were looking for or liked, they can take another impression and just start over. So you don't have to stick with what you don't like if you don't want it put on there permanently. Um, let's see. And then they'll kind of work with the lab to make sure everything is to your specifications and to their specifications. So there's usually no downtime once they're placed. You'll have them on. You can resume normal activities. You can eat and drink immediately. Until the anesthesia wears off, or unless your dentist gives you any other instructions.
Okay. So
Mhm.
do they require special care?
So yeah, so you're going to brush and floss, visit your dentist regularly like you would with your, these are still your natural teeth. They're just an enhancement to the teeth. But you want to keep them in tip-top condition because, as we know, they are an investment and it is a cosmetic investment. So um, 9 times out of 10, your insurance is not going to pay for something like this. You'll be paying out of pocket, so it's going to be all on you. So you want to make sure everything's good. So always a soft bristle toothbrush. You do not want to use. You want to use a non-abrasive toothpaste, but just make sure fluoride is in there. You're not going to use any whitening products because guess what? Whitening products are not going to work on porcelain or composite material. And the
That
whole
makes
point of
sense.
getting those is so that they are white. So you shouldn't have to do that. Um, the you have to avoid, you have to watch the way you bite into things, especially crunchy foods, any like apples or carrots, tough meats, hoagies, pizza, anything that you would normally bite into. um, you would have to chew those foods with your back teeth. So
Oh wait. So all right.
so what? Okay, well, hold on, Erica. Hold that thought, because I'm gonna answer it in the next when we go to the risk and benefits, the pros and cons. So I know
Uh,
what you're going to ask. I see it
I
in your
mean, okay. You know what I wanted to ask you to composite. I didn't ask you about this the last episode, but composite.
hmm
Now I was going to get a composite deck, right? Is that the
hmm
same material and it's
So
in your mouth?
composite dental material, no, it's different.
Okay.
Yeah, but I think that's just
Okay.
a word used for it, but it's different than that. Yes.
Okay. Just making sure. Just making
Yeah,
sure. I'm like,
it's different.
mm.
Good question though. Good question.
Okay. So what are the
So
risks?
okay,
Go
hold
ahead. I'm
on, hold
sorry.
on. I'm not
Go
done.
ahead.
So I wanted to say that the porcelain veneers, just so everybody know, is that they are stain resistant. However, it is still important to kind of limit any dark staining food. So if you drink teas or coffees or red wine or blueberries, um, or if you like a lot of sauces like ketchups or cocktail sauce, those things I said berries, yeah. Those things can stain the veneers over time. And also your other remaining teeth, so that because
Mhm.
the veneers aren't going to span all of your teeth. They're usually going to be canine to canine or premolar to premolar. So your molars are you're not going to get veneers on molars. So if you have a wide smile, because some people have a wide smile, you can see their molars when they smile,
Mhm.
then you want to avoid these because they can stain. And now Erica, take it away. It's your turn to take it
Okay.
away.
All right. So the risk and the benefits. What are the advantages of having the dental veneers since you can't eat certain foods? I need to
Okay.
know. If you do it with your like, how you gonna just do like? Let me put it in there,
Yeah.
and then now I've obviously chewed on one side, chewed on the other, but like I can't because most of the time veneers are in the front, right?
That's why I just said they're not gonna be in the back seat. So they're
Yeah,
gonna
they're
be
in the front. So they're
cutting.
like, okay, let me get it in there, get it back
Yes.
here, and like
Yes.
start chewing.
Yes.
I mean, I guess it's one thing. It's a benefit of like, oh, I'm gonna lose weight because I can't eat a hoagie, I can't eat pizza, I can't eat
Oh no.
this.
You ain't gonna do that for it's not sustainable. You're gonna eat those things at some point, right? Like
That's what
at
I'm
some
saying. Like,
so okay. So firstly, let's tackle okay the pros, right, Erica, the benefits. So they are going to do what? Dramatically enhance the appearance of your smile, so you're going to be looking,
better, so much
looking right.
better.
So long
Mhm.
as they done right, you'll be looking right. So
Looking
they'll
cute.
blend in with the natural teeth. They'll be
Mhm.
lifelike. Only a dental professional really will be able to tell whether because we know I could tell by just looking at people whether they got, and not saying they look bad, but you could just tell when your eyes are trained and you don't have lay eyes. Well, lay eyes is a term I made up myself, Eric.
Lay, because layman, lay. Yeah, I got you. I obviously I knew what you meant, and I'm sure the
Okay.
audience. I'm
I
sure
knew what
y'all
I
did too. Like, what does she mean by lay?
because when I said as a Christian, he was like, "Excuse me."
I knew what that meant. That's why I didn't say nothing. I was like, okay, she means like a trained professional, like a regular person wouldn't know.
So that's for you, babe,
Come
because
on,
I know you
Christian.
was making fun of me with the lay eyes, but that's
No, it's just your little thing that you made up.
layman eyes. But okay, whatever. Untrained. How about to the untrained
The
eye?
untrained eye. Yes, that's the term they usually use for
That's
these
what I use,
benefits.
babe. Okay, the untrained eye. So to the untrained eye, you can't tell. I can tell, but they might be looking beautiful, so that's fine. So they're going to blend it with the natural teeth. They're going to, for the most part, resist staining. Like I said, I mean, but you got to watch what you're doing on a day to day. Okay, but they do resist stain better than like the enamel on your teeth because of this porcelain. Um, they don't require a lot of additional maintenance other than what you would normally maintain for your natural teeth. And their lifespan can be anywhere from 10 to 15 years. And I'm going to put an asterisk on that 10 to 15 years. And we're going to round it out under the disadvantages.
Why? Is it because if you don't take care of them, if you're eating
This,
blueberries and cocktail sauce and ketchup,
okay.
the
So let's just
acidity?
hit the disadvantages with Erica's okay question. So, yes, Erica, absolutely correct. That's one of the things. But the other thing is like, okay, you're losing some of that natural tooth, huge disadvantage, right? And
Hmm.
then a lot of the veneers aren't reversible. Actually, all of them are irreversible. I said, except for the snap on and the no prep. So the no prep ones and the snap on, of course, right? They might become more sensitive to heat and cold because we removed now that protective layer of enamel. And that portion, so what's underneath of that is called the dentin, and the dentin is very sensitive. It has really microscopic pores, kind of like little tubules, and they lead directly to the nerve. So
Hmm.
if you're having hot or cold drinks, you may be more sensitive. Um, the last thing is that they are cosmetic and they are not covered by insurance, so you paying out of pocket. But for the lifespan of the teeth, 10 to 15 years. Now, this is the thing, Erica. You was going to ask me this question because I seen it in your eyes earlier. I heard it in your voice when you was like, "Hold up, you got to bite and chew how?" So listen, the biggest disadvantage to me, outside of removing that enamel, your natural tooth structure, is that you cannot eat the way you ate before. Because if you do, they're coming off. These things can come off over and over, and you look crazy when they come off because now a portion of the tooth is removed.
Can stuff get trapped under there where you can't get to it, and then it
No,
causes a like okay,
no, because it's bonded. So unless
okay,
there's some kind of defect or like something
okay.
going on, yeah. Other than that, nothing should be able to get underneath there. But it's listen. I had a patient today who was treatment planned to have veneers, and when she came in, I said, "Madam, are you still getting this done?" And she said, "Well, I don't really want it done. My husband wants me." And this is a older, more mature lady, probably in her late 60s, and her husband wanted her to come in and have veneers done because he wanted her to have a brighter smile. She don't even want the
Oh,
veneers. So he and I said, "Well, listen, madam, I'm going to tell you all about them." And when she was like, "Would you get them?" And so for all y'all who want to know, would I get them? That is a huge no. I would never, ever, ever give veneers because I've been
that's
doing this so
crazy.
long, and people be coming back. They come off. The composite ones only last 5 to 7 years. The porcelain ones last 10 to 15 if you can get away with not biting them. If you bite on the wrong thing the wrong way or forget and bite into something, they can come off. And guess what?
So do they? So they do damage your teeth then,
Well, by damage, if you mean remove some of your enamel, yes, they do.
because it's being done voluntarily to damage your teeth to get them put on.
It's a cosmetic procedure. Nobody has to get this done.
Mm.
Nobody has to get it done. So absolutely. So it's so you sitting in a chair like, okay, I'm okay with you shaving off a portion of my enamel to place on these veneers.
So they are permanent, but they can fall out.
They can fall off, yes. Want to get them. If you get them, my advice is to see a prosthodontist, which is
Okay.
a cosmetic dentist who all he does is place crowns, bridges,
Hmm.
veneers all day long. I wouldn't go and get these done at a general dentist unless
Or you
he's
mean the
doing
veneer
most.
technician?
And you know you ain't going to a veneer technician. I mean, unless
Yeah.
you okay with losing your teeth at some
Yeah,
point.
and that's probably about like what I was saying about that girl. She was saying all this stuff was happening and she's in all this pain and she's having this miserable experience because of her veneers.
Yeah, I wouldn't get them. I mean, they ask you, do they damage your teeth? In my opinion, listen, you taking some of the natural tooth structure off. To me, that's damage. To me, if it's irreversible and you can't take those veneers off and go back to how you look, then and you can't do that. You can't do that. Once it's done, it's done.
Yeah, how do you keep them in good condition? Let's get
You
there.
are what is happening to listen, y'all? Today is like a strange. It's a lot going on outside of what you see. So me and Erica just trying to look roll with the punches.
Yeah,
So
we're trying to,
we're get
give
through
you
it.
all the information you need for your dental health
A
care
lot
for
of
your black butt.
distractions. A lot of distractions going on
Your
right now.
brown and black behind. Here you
Yes,
go.
please do. But okay, recommendations, Erica. Keeping the veneers looking great. You're gonna brush twice
Yes.
a day, at least 2 to 3 times, in my opinion. But okay, you want to make sure you use that non-abrasive fluoride toothpaste. So the toothpaste can't be abrasive because it'll rough up the veneers. Okay, so we're not going to be polishing them and all that because you want them to be smooth. You're going to floss at least once at bedtime. Use yourself an antibacterial mouthwash at bedtime. You never want to use your teeth like a tool, honey. So stop using them to open up stuff and biting and stuff and biting your nails and can't do that. Shouldn't do that with your regular teeth either. But no more of
Okay.
that. So no more of that. No opening packages, tearing off clothing tags, or some people put like a bobby pin in it. Can't do that either. Just look good. Just look good. Don't
Mm.
do nothing regular with them.
All right. Well,
Don't bite
that's
into
that.
pizzas, don't
Yeah.
bite into candy, don't bite into hoagies, don't bite into apples or any fruit. Cut them joints
Yes.
up.
All right, guys.
You
Thanks for
know.
tuning in.
What's our
Um,
next episode, Erica, so they can be prepared mentally?
it is about oral sex and oral health in regards to oral sex.
Yes, so very taboo. But guys,
So
listen, be very tasteful because this is really like something to talk about. It's questions I get day in and day out about this particular topic. So we will be delving into that.
yes.
But until
Yes.
then, hit us up on the website, toothbetoldpodcast.com.
Mm-hmm.
Okay. Any questions, toothbetoldpodcast at gmail.com and check out our
Yes.
social.
Yes. And yes. We have it's been a
Yes.
while since we've been waiting to get to this oral sex. I mean, I wanted to talk about this like on the first episode, y'all.
She did. And
And
I
we
was like, yeah, no,
was like,
that's
no,
that's
we ain't
like
having
no.
that. We ain't having
It's a little
that.
bit much. Like
That's
let's
like,
figure
but
out this
it would have been it would have been pop. It would have been like, yeah.
would have been
So,
pop.
all right. Thanks, guys, for tuning in as always. Check you out next time.
All right, take care, guys.
All right.
Bye.
Bye.